Hello and welcome. Today we're diving into a serious condition affecting the brain, a brain abscess. We'll explore what it is, what causes it, how it's diagnosed, and the available treatments. This information is for educational purposes and should not be considered medical advice. Always consult with a qualified healthcare professional for any health concerns. A brain abscess is essentially a pocket of pus in the brain. But what causes this infection? Most commonly, it stems from bacterial infections that spread from other areas of the body. This could be a sinus infection, an ear infection, a dental infection, or even a lung infection. Sometimes, it can arise after a head injury or surgery where bacteria are introduced directly into the brain. Less frequently, it may result from blood-borne infections originating in the heart or other organs. The bacteria involved are often a mix of aerobic and anaerobic organisms, with Staphylococcus and Streptococcus species being frequent culprits. The development of a brain abscess is a complex process. First, bacteria gain entry into the brain tissue. This triggers an inflammatory response from the body's immune system. Immune cells rush to the site of infection, releasing inflammatory chemicals. As the infection progresses, a localized area of inflammation forms called cerebritis. Eventually, this area becomes walled off by a capsule, forming the abscess. This capsule is a protective barrier created by the body to contain the infection. However, this capsule also makes it harder for antibiotics to reach the bacteria within. Inside the abscess, pus accumulates, consisting of dead cells, bacteria, and inflammatory debris. As the abscess grows, it exerts pressure on the surrounding brain tissue, disrupting its normal function and causing various neurological symptoms. Brain abscesses are relatively rare, but they can occur in anyone. Those with weakened immune systems, such as people with HIV/AIDS, organ transplant recipients, or individuals undergoing chemotherapy, are at higher risk. People with congenital heart defects are also more susceptible. While the exact incidence varies depending on geographical location and population studied, it's estimated that brain abscesses affect a few people per million each year. Early diagnosis and treatment are crucial to prevent serious complications. The symptoms of a brain abscess can vary depending on the location and size of the abscess, as well as the overall health of the individual. Common symptoms include severe headache, often localized to one side of the head. Fever and chills are also frequent indicators of infection. Neurological symptoms can manifest as seizures, weakness or paralysis on one side of the body, speech difficulties, vision changes, confusion, and changes in mental status. In some cases, nausea and vomiting may also occur. The symptoms can develop gradually over a period of days to weeks, or they can appear more suddenly. Any combination of these symptoms warrants immediate medical attention. Diagnosing a brain abscess requires a thorough neurological examination and advanced imaging techniques. A CT scan with contrast is often the first step in visualizing the abscess. MRI, or magnetic resonance imaging, is even more sensitive and can provide more detailed information about the abscess, its size, location, and surrounding inflammation. Blood tests are also performed to look for signs of infection, such as an elevated white blood cell count. In some cases, a needle aspiration or surgical biopsy of the abscess may be necessary to identify the specific bacteria causing the infection. This information is crucial for selecting the most effective antibiotics. While specific classifications based on abscess type are not universally used, abscesses can be broadly categorized based on their origin. We can consider them as either contiguous, meaning they spread from a nearby infection like sinusitis, or hematogenous, meaning they spread through the bloodstream from a distant infection. Also, we might categorize them by the number of abscesses present, where one is a single abscess and more than one are multiple abscesses. Treatment for a brain abscess typically involves a combination of antibiotics and surgical drainage. High doses of intravenous antibiotics are administered to fight the infection. The choice of antibiotics depends on the specific bacteria identified in the abscess fluid. Surgical drainage may be necessary to remove the pus and relieve pressure on the brain. This can be done through needle aspiration or by surgically opening the skull to access the abscess. In some cases, if the abscess is small and easily accessible, antibiotics alone may be sufficient. Close monitoring of the patient's neurological status and repeat imaging are essential to assess the response to treatment. Medications to control seizures and reduce brain swelling may also be used as needed. While it's not always possible to prevent a brain abscess, there are steps you can take to reduce your risk. Prompt treatment of infections, such as sinusitis, ear infections, and dental infections, is crucial. Practicing good hygiene, including regular hand washing and dental care, can also help prevent infections from spreading. Individuals with weakened immune systems should take extra precautions to avoid infections. If you have a congenital heart defect, talk to your doctor about the risks and preventive measures. The prognosis for a brain abscess depends on several factors, including the size and location of the abscess, the underlying cause, the patient's overall health, and the timeliness of diagnosis and treatment. With prompt and appropriate treatment, many people recover fully. However, complications can occur, such as permanent neurological deficits, seizures, or even death. Recent research focuses on improving diagnostic techniques, developing new antibiotics to combat resistant bacteria, and refining surgical approaches. Scientists are also exploring novel therapies to enhance the body's immune response to infection. Continued research efforts hold promise for improving the outcomes for individuals affected by this challenging condition. Thank you for watching.